Hi everybody, it's Laurie Monks here. Welcome to today's webinar. I'm going to go over part 2 of the account specifics. So a couple of weeks ago we did part 1. That is posted on the student forum if anyone is looking for that. We went over the first half of the account specifics then. Today we're going to go over the second half. So thanks everybody for coming. I appreciate it. Okay, so the first thing that comes up in the second half of the account specifics are numbers. So what I'm going to do is just read over each of the spec rules, and then I will expound on that. So first of all, do not begin a sentence with a number. This should be changed to a word. However, if the number represents a dosage or a lab value, you're going to need to recast the sentence. An exception for the rule would be a number that stands alone under a heading. So let's just pick that apart for a second. If you have a number starting the sentence, then ideally you want to try to recast. Now, if it's a dose or lab value, actually you're required to recast, but I would just recommend to you, if it's any sort of a measurement, if it's an age or vital sign or something like that, I highly recommend that if you're able to find a way to recast that doesn't go against verbatim, so you're making a very minimal change to recast it, I would recommend that, because if you just pretend for a second that you're a family doctor, you're super busy, and the note comes to you from your patient having been in the hospital, or say you are, an evening shift doctor and you're trying to read notes from earlier in the day for that patient, oftentimes they're scanning for information, and any sort of measurement, if you have it in numeric form, it's going to pop. It's a lot easier to find. So I try to keep ages, vitals, height, weight, BMI, labs, and doses as numerals whenever I can. But just remember, in terms of the account specifics, it's the dose and the labs that are required to be recast to keep them as numerals, okay? And then that whole section there about exception for a rule will be a number that stands alone under heading. Just to go a little bit more into that, the second example there, estimated blood loss, 100 milliliters. So locus style 1.2.6 goes into this a bit more. And basically, if you have a quantity, so there's a numeric measurement there, and a unit of measure, and they come right after the heading, you can keep that in numeric form. And somebody has got their camera on their computer. So if you could just make sure that your cameras are turned off, your video. Thank you very much. So basically, if you have a numeral or a measurement, and then your unit of measure, if it's coming right after the heading, you can keep that in numeric form. You do not have to recast for that. However, if we look at the first example there, 10 milliliters was injected under the skin. So 10 milliliters would be a dose. They're injecting some sort of medication or something under the skin. So you would recast that to then, and there shouldn't be a comma after then because it's a short introductory element that answers when. So 624 talks about that, but that is besides the point, getting off track. Then 10 milliliters was injected under the skin. So that is one way to recast. You could maybe do next 10 milliliters was injected. We'll get into that a little bit more in a second. So there's sometimes more than one way to recast, and we'll talk about that in a minute. Okay, so here are some examples. So let's say they dictated, 5-year-old boy was reviewed for asthma. You hear that a lot where they start with just the age. So try adding a or an. Obviously, if it was 8-year-old boy, you'd have to say an 8-year-old boy for grammar. But if you can just add a, an, or the to the start of the sentence to recast, and it makes sense, do it that way, because that is a very minimal change that you're making. So if they start the sentence with the age, put a or an ahead of it so that you've kept that age as a numeral and you're not starting the sentence with a number. Okay, 2 centimeters of snow fell. So this isn't really an important measurement for the doctor. It's not an age, it's not a dose, it's not a lab value, it's not a vital sign. So you could just leave this as 2 centimeters of snow fell. As a quick note, with metric units of measure, you only want to abbreviate centimeters to cm if it's actually accompanied with an Arabic numeral. So if it was the number 2, then you would write 2 and then cm. But in this case, we've written out 2, so you don't abbreviate that metric unit of measure. It's just a little tidbit for you. Okay, this is very similar to before. 2 milliliters of xylocaine was administered. So there's a few ways you could do this. Then 2 milliliters, next 2 milliliters. You could just take the medication and the dose and flip them. Xylocaine 2 milliliters was administered. So there's few ways that you could do this. If it wasn't possible to just quickly flip the 2, or you couldn't add then or next, it somehow, for whatever reason, didn't make sense, then see if you could put a semicolon and join it to the sentence before. Because the semicolon can be used to join 2 complete sentences that are closely related. So if you're really stuck, look at that. So there's more than one way to recast. You just want to make the minimal amount of change possible. Okay, estimated blood loss, 200 ml. This is what we talked about before. So again, we've got a quantity, we've got a unit of measure. They're coming right after a heading, so we can just leave that as is. We don't need to worry about that starting a sentence with a number in that case. Okay? Okay, all numbers will be typed in Arabic format, even those below 10. So a lot of people in English writing, we're used to writing out the words below 10, but in transcription, we're going to write them as Arabic numerals. Again, it's just they pop. It's easy to see. So that's likely the reason behind it. So there are a couple of exceptions. Of course, there's exceptions to almost everything. So for other ways to format things, so basically Roman numerals generally, have a look at the Book of Style. The course will talk about Roman numerals as well, but just looking down at the bottom there where the tip is, Book of Style version 3 has specialty chapters that I love. So chapters 13 to 24. They are well written, they're easy to understand, they are specific to certain topics. So for example, the oncology chapter, which I believe is chapter 16, would talk about how to format stages, grades, and so on. So some of them have Roman numerals, some of them have Arabic numerals. A really good example for this too is when I was in the workforce, the hospital that I worked in was downtown Toronto, and there was a lot of fights on the weekend. And there were a lot of these facial fractures called Lefort. And they would say Lefort level 2, for example. And I would go online and I would look, and Lefort in one place would have a space after le, and then it would be Arabic numerals, and another place would have no space, and it would be Roman. And I would just, the more I looked, not only was I losing time, I was getting frustrated. So if I had just gone to the orthopedic chapter, which is chapter 18, the most common classification systems, so stages, grades, and levels for each specialty will be in those specialty chapters. So if you just go to the cover page of the chapter, it will list the references down the side, and you'll see if there are classifications listed. And if there are, they're just going to be the most common ones for those particular specialties, but it will show you if it's going to be Roman numeral or Arabic numerals. If I had just gone to the orthopedic chapter sooner, I would have seen Lefort, no space, level 2, Roman numerals. So it would have saved me lots of time and frustration. So just don't forget those specialty chapters are there, and they're going to help you as well with whether or not you need to use Roman numerals. Okay? Okay, so going back to the rules here. Spell out number 1 when used as a noun or a pronoun. So if it's being used as an amount, you're going to use the numeral 1. But if it's being used as a noun or a pronoun, you're going to write it out. So she will be the one to contact us to schedule an appointment. It's being used as the pronoun there, so we write it out. The physician compared his right arm to the other one. So a good test for this that I use is to replace 1 with 2, for example. Now, it might not always work with plural agreement, but if I were to say she will be the 2 to contact us, that doesn't make sense. That helps me know that it's not being used as an amount. It's being used as a pronoun, so I would write out the word. That helps me quite a bit. So just a tip for you. Okay, so then the next is when 0 is used as a general expression, spell it out. If used as a unit of measure or classification, use the numeral. So it's kind of similar to 1. So he had 0 tolerance for nonsense in the classroom. We can't say he had 2 tolerance for nonsense. It's not being used as an amount. It's being used as a general expression. So we're going to write out the word. But if 0 is being used as a numeral, an amount, you need to use the number 0, okay? Okay, so with the exception of diagnosis, impression, and assessment, don't create a numbered list if not dictated. So if, let's just pretend you're in medications and they say medications, Lipitor, Effexor, aspirin. You're just going to write that out as a sentence form list. You're not going to write a numbered list. If they say something to indicate they want a list, as we talked about in part 1 of the account specifics, so say they said medications number 1, Lipitor, Effexor, whatever, you're going to make a numbered list. They may not always number correctly. They may not always say number 2 or number 3. They might not give you a number until they get to number 4. So you just have to really keep your ear out. Also, just be aware, are they saying number 2 for number 2 in a list, or are they saying 2 as in the word 2? Same with 4. Watch out for that. They might say something like next, 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 next line, next line, next line. So if you can tell they're talking about the same topic and they're listing things and they're saying something to indicate like we want to make a numbered list here, you have to make the numbered list. But if they don't, and you're not in a diagnosis, impression, or assessment section, you're going to write it sentence form list, okay? Okay, ordinal numbers are used to indicate order or position in a series rather than quantity or an amount. In the health record, however, ordinals should be expressed with numerals, so 1 ST, 2 ND, and so on, to promote clarity of communication. Do not use a period. So there's some examples there. She saw the nurse practitioner in her 2nd trimester. So you have a 1st trimester, you have a 3rd trimester. So 2nd trimester is clearly part of a series, so you write it as a numeric ordinal. He should come back to the office on the 5th day after a surgery. So it's the 5th day. He's obviously had a 1st, 2nd, 3rd, and 4th day. So part of a series, you're going to write it as a numeric ordinal. Now, I have a little example here in this pinky box. For the 2nd time that day, I thought about signing up for a first aid course. So for the 2nd time that day, clearly there was a 1st time. So that's part of a series. We're going to write it numerically. Now, please just ignore the fact that the ND is in superscript. That's raised up a little bit higher. When you write it in dicto, it will just be level on the line with the 2. That's perfect. That's fine. Where I have first aid course, you know, there's no 2nd aid, there's no 3rd aid. First aid course is a general expression, so you write out the word. Okay? All right, dates. Okay, transcribe dates verbatim. However, do not use ordinal numbers. If the date has been completely scrubbed from the document, type the placeholder for date. Now, an exception for ordinals would be if they said the patient was seen on the 7th. So if they said that they were seen on, I don't know, September 6th, so 6th, TH, 6th, that's very hard to say, you would write September 6th and take the ordinal off. If they said we saw him on the 7th, there's no month, there's no year, you will use the ordinal. So that's an important distinction. It has to be just that by itself. Now there's a number of examples here for dates. So what I highly recommend you do is basically listen to the date that's dictated, come into your specs. For me to find the date page quickly, I click into the specs and then I type Control F for find. When the box comes up, I type in June, and that takes me right down to the dates quickly. Just look at all of the examples and try to find the one that matches what they said. So for an example, if they said May of 07, then you're going to write May of 07 with an apostrophe before 07. But if they don't say of, they just say May 09, for example, then you're not adding that. You are still using the apostrophe. There's just little things there that you should have a look. Now, if we look at that second to last example, 040417, let's pretend that they said 4417. Then don't add those extra zeros. You would just write 4/4/17. If they were to say 04 417, you would write 04/4/17. So don't add the extra zeros when not dictated, okay? That's something that I see quite a bit. So just as a little heads up for you. Okay, capitalization. Okay, department names. Let's just look up at the top first. So for department names, clinic names, specialty names, basically. Any name that follows the name of the facility it belongs to, you're going to capitalize. So in that first example, patient presented to the Toronto General Emergency Department last night. So Toronto General is where that department is located. So because it's following directly after the name of the hospital, it just becomes one big proper noun. So you're going to cap it. But if it doesn't follow the name of the place where it's located, it's generic. It could be any facility, and you don't cap it. So the trick at the bottom there, this is something I was taught when I worked, it's now called Acuity, it was called a modal at the time. So when that department name or specialty name is out on its own in the sentence, then you're going to replace it with Dr. Smith in your head. You could use your own name if you want and read it back like that. So let's look at the specimen was sent for pathology. The specimen was sent for Dr. Smith. I guess it makes sense, but you have to watch there that we're actually talking about the test itself, not the department name. If you said the patient will be seeing derm, you can say the patient will be seeing Dr. Smith. That makes sense. We're not talking about a test. We're talking about a department. So, okay, so Dr. Smith works, so we're going to cap derm. If you said the patient was seen in radiology, okay, the patient was seen in Dr. Smith. Unless Dr. Smith ate that patient, it doesn't make sense. So you would not capitalize radiology if you said the patient was seen in radiology. If you said the patient was seen by radiology and you said, okay, seen by Dr. Smith, perfect, it works. So you would cap radiology in that case. So for me, that helped quite a bit. I don't have an example of this written down, so this might be hard to picture in your head. But if you think how they say the patient will see doctor name, comma, urology. So that added little tidbit at the end of it, you know, the department name or specialty that that doctor works for. A lot of people will think, okay, the patient will see doctor name, Dr. Smith. That doesn't really work, so they don't cap urology. But what you should do in that case is take out the doctor's name that they dictated and then test it. So if you said the patient will be seen by doctor name, comma, urology, take out doctor name. The patient will be seen by urology. The patient will be seen by Dr. Smith. It does work, so you would cap urology. So don't let that extra name in there confuse you. Okay, all right, so let's just go back, see if I missed anything. Book style states that when a specialty is used as an organizational entity, it will be capped. When it is their primary or common meaning being referred to in the sentence, they're not capped. So we're just kind of using the Dr. Smith trick to basically replace it with another proper noun. And if it works, it's acting like a proper noun, so we should cap it. But just be really careful, like things like occupational therapy will say. You have to watch, because are we referring to the specialty, like the department, or are we referring to actually receiving occupational therapy? So watch that. You have to look for things like that. Path is another one, or pathology is another one. Massage therapy is another one. So just really watch out for that and decipher, do we mean actually like hands-on therapy or actually having pathology done, having lab tests done, or are we talking about the department? If we're talking about the department, go ahead and do your Dr. Smith trick and see. Now, the exception to the Dr. Smith thing would be if that and then center, clinic, service, department, room, so on, those sort of generic nouns, it's really rarely capitalized unless it's like a business name. So for an example, where I live, there's a lot of seniors, so a lot of our little plazas have clinics in them, like the audiology clinic, and that could be the business name. So if you were to write a check to them, it would be to the audiology clinic. That is a legal business name, so you would cap it because we're talking about a business. But generally in our reports, we're just talking about clinics and so on within hospitals. And you can't grammatically say it correctly, like say emergency department. you usually say the before it. You know, he was seen in the emergency department. You wouldn't say the Dr. Smith. Now, you will occasionally get a dictator with poor grammar who doesn't say the, seen by emergency department. Then you don't have a choice. But usually they're not capped when it ends on those generic nouns. Okay, there's a lot of info on that one. Capitalize all eponyms, so words named after a person, proper nouns, personal names, places. So basically any proper noun, you're going to cap. With regards to eponyms, these are words that are named after people. We do get into them a bit more later, but if you're ever unsure, you can always say, like, okay, pot scissors as an example. You could go online and say, who invented the pot scissors? And it would probably bring you to something about someone with the last name Potts, and then you would know. So I've been known to do that on occasion. So if you're really stuck, that's the way you can look. Okay, so for drugs, capitalize brand names appropriately. You can refer to your provided resources and ebooks to help you distinguish between a generic drug or brand name. We'll get more into medications in a bit. So there are a couple of webinars about drug research on the forum. We'll get to those as well, but just as a heads up for that if you're having trouble researching those. For immunizations and vaccines, you want to capitalize the first letter of those. So the patient will receive the shingles vaccine today. We're talking about the vaccine, so we capitalize the word shingles. Don't cap the word vaccine, just the word shingles. The patient is susceptible to the flu, so will receive the flu shot on this visit. So flu shot, we're talking about the vaccine, so we cap the word flu there. But when we talk about susceptible to the flu, we're not talking about the vaccine, we're talking about the illness, so we don't cap it there. So just watch out for that, okay? Capitalize all medical brand names. That's pretty clear. So if it's a tool name, anything brand name, some sort of dressing name or something like that, Curlix wrap, for example, Curlix is capped. So getting more into that, all brand names should be capped. They, again, could be med names, could be surgical tools, medical products. If it's a generic name, don't capitalize it unless it's the first word in the sentence or in a numbered list. So an example, a bandage is generic, but Band-Aid is a brand name bandage. So you would capitalize Band-Aid, but not bandage. If you think of like in drug terms, no, actually, you know what? I'm just going to go completely off of medical topics. If I say cola, that's generic. Cola, we don't cap the C. But if I say Pepsi, you're going to cap the P in Pepsi because it's a brand name of cola. It's very much like that. So bandage is generic. Band-Aid would be a brand name bandage. So we would cap Band-Aid. Okay, abbreviations. Abbreviations that represent diseases should be transcribed as dictated, except in the diagnosis, assessment, and impression sections where you must expand those. So if it is an abbreviation that represents a disease, and don't just think something contagious, think a health issue. If it represents a health issue when you expand it, you're going to expand it when you're in a diagnosis, impression, or assessment section. Now, if it is a non-disease entity abbreviation, so anything else, then you're not going to expand it unless it's dangerous, of course, so we'll get to that. So there's more in the book of style about that. And then brief forms are not considered abbreviations in the program. So again, I did talk about this in part 1, but a brief form of a word would be like a shortened word, like exam instead of examination. And then an abbreviation is when letters stand for words when you expand, like MI stands for myocardial infarction, okay? So there's an example here that the diagnosis is CHF. So CHF means congestive heart failure when we expand it, which is a health issue. We're in the diagnosis section, so we have to expand CHF there. Now we talk about diagnosis, lung CA on CT scan. CA means cancer, and CT is computed tomography, I believe. So cancer is clearly a health issue, but CT is not. So we're going to expand CA because we're in the diagnosis, so lung cancer, and then CT scan we leave because CT does not represent a health problem. So some examples below here. If MI was listed in the diagnosis, impression, or assessment, myocardial infarction, that is a health problem, that's a health issue, so we would expand it. If they said something like GI pain, yes, GI pain itself is a health issue, but GI, when we expand it, means gastrointestinal. So the letters it expands to, or the words it expands to, doesn't represent disease. Gastrointestinal is an anatomical location. So GI pain, though GI pain is a problem, a health problem, GI itself is an anatomical location, so we wouldn't expand it. And also remember, say MI for an example, if they dictated that in any other section of the whole report, you wouldn't expand it. It's only in the diagnosis, impression, and assessment. Okay, dangerous abbreviations should not be used. Please refer to the Book of Style for a list of dangerous abbreviations that should be avoided. Incorrectly transcribing a dangerous abbreviation will result in a critical error. So going down to the bottom here, the full list is in 3 sections of Book of Style. So 931, 932, and 933, that will be your full list of them. Now, I highly recommend that you review these frequently. Maybe as you're just getting familiar with them, you might want to look them over every day or every other day quickly. You're not trying to memorize them, so don't panic because there's a lot. But you want to get comfortable or get to know them well enough that when you hear one, you kind of go, oh, ding, ding, okay, I think that's on the list of dangerous abbreviations, and you can go and check what to expand it to. Now, there are certain ones that you're going to hear over and over and over, and you're just going to memorize them through repetition. But there's other ones that you might just hear now and then, and if you don't review them often enough, you'll forget them and you'll miss them. So I found that once I got pretty comfy with them, I would just quickly read it over every couple of weeks, because I didn't want to forget any. And sure enough, there would be one that just came once in a blue moon, and I'd be like, I think that's on the list, and I could go look it up. So just as a suggestion, I do highly suggest that you review them frequently. So for an example, blood loss 300 cc should be changed to blood loss 300 milliliters. So cc and an ml are actually the exact same amount, and cc is dangerous. You'll notice if you look in Book of Style that usually dangerous abbreviations are ones that look similar or sound similar to other abbreviations and could be mixed up or read incorrectly. So we expand them to something else. For an example, QHS, we would expand to nightly. So, and the other thing I do see is oftentimes people will say, okay, QHS, I'm going to expand, but then they'll leave the Q in and they'll go Q nightly. Just take out the whole dangerous abbreviation and replace it with what the Book of Style says. So QHS, just write nightly instead. Okay? All right, eponyms. Okay. Again, an eponym is a word named after a person. We want to write this with an initial cap, but don't capitalize the noun following. So Lyme disease, Lyme is named after somebody, but disease is not. So Lyme disease, cap Lyme. Foley catheter, Foley is named after someone, so cap Foley but not catheter. If an eponym is written in the verb or adjective form, we don't capitalize it. So bovete, so that is verb. So you might hear them say that they were cauterizing bleeding vessels with a bovie electrocautery, but what they might say is we bovied the bleeding vessels. It is just a slang that's become accepted because they say it so much. Parkinsonism is an adjective form for someone who has Parkinson's disease. So adjective form, don't cap. Verb form, don't cap. Now, when the eponym is followed by a noun, the apostrophe S is dropped. If the eponym is not followed by a noun, you keep the apostrophe S. So oftentimes they'll say the patient has Alzheimer's disease, but if that's followed by the noun disease, we need to take that apostrophe S off. Even if they said it, take it off. And then if they just said the patient has Alzheimer's, it's not followed by the word disease, so put the apostrophe S on. Okay, if you're not sure, again, if it's an eponym, you can always try Googling who discovered Alzheimer's disease, for example, and see what it says. But there are certain ones you're going to hear so often, you'll get to know them as well. But so if it's followed by the noun, take the apostrophe S off. If it's not followed by a noun, it's not a verb, it's not being used as an adjective, put the apostrophe S on. Okay, medications. Type your medications verbatim. Do not list if not dictated as a list. We talked about that earlier. Brand name drugs are capitalized, generic names are not. Now, if your generic name happens to be the first word in a sentence or in a numbered list, you would cap it. That's the only time. That really confused me as a student. So now you know if that generic drug is not the first word of the sentence or in a numbered list, don't cap it. If it's a brand name, it's always capped. Names of illegal or illicit drugs are not capped. So Ativan is a brand name drug, it's capped. Lorazepam is a generic name. Don't cap it unless it's the first word of a sentence. Heroin and cocaine are both illegal drugs, so they're not capped. Refer to your provided resources in your ebooks to distinguish between brand name and generic. Now, I know that there are troubles with the ebooks right now. My Quick Look Drug book does work, so check yours. Drugs.com is another good resource for drugs. Just make sure that, I don't know, let's just say you're looking up ibuprofen. Make sure that when the results come up, when you search ibuprofen, that you go into the page, and then it will tell you ibuprofen. It'll say clearly generic drug, ibuprofen, brand names, Advil, Midol, etc. So don't just look at the fact that it has ibuprofen when you search it. It'll be capped because it's sort of like the title of the page. But once you go in, that's when you're going to see which is generic and which is brand, okay? Now, capitalization is really important. There is a big difference between Coke with a capital C and Coke without. So Coke, capital C, that's your drink. Coke without, that's your cocaine. So as someone who did quality assurance on coworkers and fields and blanks, I saw that error more than once. So be careful with that. And I talked about earlier that there are a couple of webinars on the student forum to help with medication researching. So there's the name, How to Become a Medication Research Sleuth. I did that one. It's a terrible name, I'm sorry. But I talk a little bit about drug classes, what suffixes some of these drugs have that might help you figure out what you're seeing. I talk about the Quick Look Drug Book, and I talk about drugs.com actually quite a bit because all of my accounts wanted me to use that in the past. And then Maneuvering and Mastering Medication Mysteries is another one with just some other tips because everybody does things differently. So if you really want a full, well-rounded information on how to do drug research and information about that, watch them both. Okay, trailing zeros. Oh, my little zero picture is way down there. Okay, do not transcribe a trailing zero in a drug dose. So as an example, Ativan 2.0, 2.0 milligrams, so you're not going, that's a trailing zero, so it's coming after the decimal. Okay, so don't transcribe a trailing zero in a drug dose. The decimal might be missed, and this could result in the patient getting a drug dose of 10 times of the prescription. So 2.0 milligrams could be read as 20 milligrams. That would be a very critical mistake. Transcribe a trailing zero if dictated in other areas. So reports, temperature, you will often see them give labs or temperatures with a trailing zero just because it shows a bit more accuracy. Now a leading zero would be a zero coming before the decimal. So you must transcribe a leading zero in a drug dose of less than 1. So anytime that you've got a decimal and it starts like 0.4 milligrams, you've got to put that zero in ahead because the decimal could be missed and this would result in the wrong dose again. So if they said 0.4 milligrams of Flomax and you didn't put that zero in, they might think it's 4 milligrams. It's very easy to miss that little period there. So if they say 0.4 milligrams, you're going to write 0.4. Now, with that leading zero, that's actually on the dangerous abbreviation list, even though it's not technically an abbreviation. So if that leading zero is missed, that's protocol, or not protocol, that's a critical error. So watch out for that. The trailing zeros are usually protocol errors. just as a tip. So just have a look, trailing zeros and leading zeros, keep those in mind. If a trailing zero is dictated in a lab measurement, BMI, you go ahead and transcribe it. So in the example there, hemoglobin 14.0, transcribe that. That's the measurement. They're just trying to show you a bit more accuracy with that. The patient had a 0.8 centimeter lesion. If they had said 0.8, you have to transcribe 0.8. Miscellaneous. Okay, we're working our way through here. Contractions are not used in medical transcription. So contraction would be words like can't, don't, wouldn't, those types of things. So you don't want to use these in medical transcription except in a direct quote. So it's time to give him his medication. Change it's to it is time. In the second one, the woman yelled, "It's on fire." We would keep the word "it's" in the quote because we want to say exactly what the patient said. So if it's outside the quote, expand. If it's inside the quote, leave it as is. So as an example, the doctor didn't like it when the patient said, "I don't like you." So you would transcribe the doctor did not like it when the patient said, "I don't like you." So we're going to keep the contraction in the quote, but the contraction that was outside of the quote we're going to expand. And that will become second nature to you over a bit of time. It doesn't take too long. That when you hear the doctor say contraction, it's not part of a quote. You're just going to know to expand it. So keep an eye on that. Okay, time. So using an X to replace the word times. So let's just be clear that we're talking about how many times something was done. We're not talking about dimensions, like 2 times 3 centimeters, for example. Okay, so if transcribing an X to replace the word times, meaning how many times something was done, it's only used with digits, so numerals. The X should only be used immediately before the number. Don't put a space between the X and the digit. And by the way, the X should be a lowercase x. An uppercase X represents magnification. So if you said something was magnified times 20, you would put a capital X and then 20. But in this case, we're not talking about magnification, so we're going to use a lowercase x. That's in Book of Style 9.4.2, where it talks about symbols right near the end because it's X. So the patient has been admitted times 3. So the word times is coming right before the number 3. So then we can use the X instead. The patient has been admitted X3, which just means times 3. But he was seen 3 times in the past month. The word times is coming after the number, so we write out the word times. If they said something like, I don't know, times about 20, sometimes they'll say something like that, then there's the word about between times and the number, so you're going to write out the word times. It has to be right before that numeral. Okay, acceptable variations. All right, there may be some items showing up as errors on the differences tab that are actually acceptable variations. So when you see your merged key, there might be some stuff that's showing as an error, but it's actually fine. So please refer to the Acceptable Variations Guide link at the top of each dictation. So I've shown you a little screenshot there. But when you're in your dictations, it's the link to the top left there, just above your audio bar. You can also find the same thing in FAQ section. So if you were to click on FAQ at the top of your course material, and then in the search bar, that'll come up on the FAQ page, right, acceptable variations, it'll pop up the same thing. So a really common example would be vital signs. BP 120/80, respiratory rate 20, I don't know, temperature 97, I'm making something up. So you can write that with periods between. You can write it with commas between, although if one of your vital signs has a verb dictated, start a new sentence for that one. But otherwise, you can go with commas, you can go with periods, and that drives students crazy because they'll do it one way in one report and it'll have periods in the key, and then they'll do it with periods the next time and the key will have commas. It's perfectly fine. So as long as one of those vital signs is dictated with a verb, you start a new sentence for that because it's a new independent clause. We got a subject and a verb. So that's just an example. So that, just have a look at that. That will help. There's also some webinars on the acceptable variations as well. Proofreading. Please remember to carefully proofread your document before you submit your reports. I thought I'd go over a couple of proofreading tips. One would be, when I was a student, this was my issue. So for me, when I read really fast. And what was happening was I was proofreading the same way I'd read a book. And I was just right straight through, probably reading too fast. And there was a couple of things that were happening. One was that I was reading so quickly that I was skimming over errors, like say the word patient without an I. I see that almost every day from students because it's really easy to miss that I if you're reading too quickly. The other thing that would happen was almost like my brain would put in what it knew should be there, but was missing what was right in front of my eyes. So what I was taught, and these are just some baby steps, the first step was to read each sentence out loud and stop. Now, some of you have heard me say this before in other webinars, so I apologize. But for those of you who haven't yet, read one sentence out loud and stop. Feels kind of silly, but when you read out loud, if the sentence doesn't make sense, if the sentence is incomplete, if there's a grammar mistake, you're going to hear it when you say it out loud. So if you're somebody that when you're speaking with a friend, if you make a grammar mistake, like say you said, I don't know, the people is, and you're like, oh, I mean the people are. If you're one of those people, this is going to work great for you because as soon as you hear it, you have to say it yourself. As soon as you hear yourself say it, you'll know something's off. So those types of errors, you'll hear that something's off. You can go and listen back to that little sentence and see, did I miss a word? Did I mishear something? Or did the dictator make a mistake, like a grammar mistake, and I have to fix it? It slows you down just enough to help you catch spelling mistakes and stuff like that that you might have skimmed over. And then just quickly check it for formatting, punctuation, and all that. In terms of commas, if you're reading it out loud, and you guys have heard me say this before, but if you sound like Christopher Walken or Captain Kirk and you are pausing in the weirdest of places, when you read it out loud, check your commas. You might have gone a bit comma crazy. Sometimes we need certain commas because some of the sentences are quite convoluted. We don't really have a choice, but reading it out loud is helpful. When you're done with the one sentence, read the next sentence out loud and so on. It sounds like it takes forever. It really doesn't. When you start to notice that you're catching more errors and your reports are getting more accurate, then just do the same pattern in your head silently and just read out loud if something's off. You can't quite figure out why. It sounds like it takes forever. It sounds like it's really babyish. It really is fairly quick. And what's important is you're training yourself to proofread in the staccato rhythm. One sentence, stop. One sentence, stop. When you get into the workforce and you've been there enough that you know your accuracy is good, then you can proofread as you go. One sentence is typed, proofread, typed, proofread, the same pattern. So when I proofread now, I proofread in that rhythm, and when I read a book, I still trek on through there really fast. So that's something you can try. The other one that I suggest is more for students who, if you find when you're proofreading against the audio, that what you hear is almost coloring what your eye sees. So say on the page it had the word exam, and in you're listening back and you hear them say examination, and you don't catch the fact that you just heard examination, but your screen says exam. You're not catching those things because it's like your ear prejudiced what you see. Then this is for you. So if that is the case, or you want to check to see if that's the case, when you're proofreading against the audio, just close your eyes, listen to a little chunk, just enough that you can remember it. Listen to that little chunk and then open your eyes and see if what you just heard matches. So you're not listening and looking at the exact same time. So I've had a practicum student in the past where that made the world of difference. That was like day and night for her. So try them both. and see what you think. Use a combo of both if you want to. But those are just some proofreading tips to help. References. Okay, so here is our hierarchy of references. Make sure that your references are reputable medical references, such as the Book of Style or your Stedman's resources. And yes, I am aware that the Stedman's resources, there are 2 ebooks that are not working right now. Stedman says it has something to do with trying to work around the fact that Flash Player will be defunct as of the end of the year. So that's what's going on. If you are looking for added resources, go to my Filling in the Blanks webinar in the forum and get the handout that is below the video. The link is in black. It's kind of hard to see, so have a look. Also, if you were to go into your course content, click on Content, then click on Overview. In the links that come up, there's another one with resources that are through the school. So that there are some that are different in each, so have a look at both. But basically, when you're filling out a report, always the account specifics first. If the doctor tells you to start a new paragraph in the middle of the physical exam, no, I'm not going to do that because the account specifics don't want me to do that. The account specifics always get their way. They come first. If there is something in the Book of Style that conflicts formatting as opposed to account specifics, you're going to go with account specifics first because that's what your company wants you to do for formatting. So account specifics first. Then comes your course material. So all of the stuff in your course content. So if you're looking for spelling, you can always go there. Book of Style is next. And again, don't forget those specialty chapters. Chapters 13 to 24 are golden. And I just keep telling you about them because I was sick when I realized what was in there and how much time and frustration I could have saved myself. So account specifics first, then your course material, then the Book of Style, and then your school-issued resources. So that could then be your Stedman's online dictionary, whatever Stedman's ebooks are working. And if you still can't find something, then you want to go online and use some reputable sites to try to find your information. If you're looking in terms of formatting things, always go to the specs first. And if you can't find it in there, then go to Book of Style. In terms of trying to find a rule in your specs, I talked about this in the last webinar, but I tend to open the account specifics and then do a Control F. So hold Control button down, hit the letter F for find. A little search bar will open. So say I wanted to find a rule about headings. I would just type in the word head, and it will bring up whether the word heading or headings plural. It'll bring up both. And I can go through, and find every little rule that has to do with headings. I do that instead of just going to the headings section because sometimes there's a little rule that's hidden somewhere else. So that way I don't miss it anywhere. And if I can't find it, I'll go to Book of Style. And if you're having trouble navigating your Book of Style, there is a webinar called Resource Rescue that I did. And I will show you how to use the Stedman's, Vital Source. The Vital Source desktop version, and then I'll show you the online web page version, which is my favorite one. So I'll show you how to use both because they look a little different. And I'll show you how to look it up if you know the word you're looking for, if you know the reference you're looking for. And I'll give you tips on how to look for something if you're not sure what word to look for. So that information is all there. Okay, corrections. Dictators will often add or delete dictated information in a report. It's important that you recognize when the dictator has made a change and correct the dictation as directed. It could mean you're adding or deleting words or sentences depending on the correction they make. An effort must be made by the student to correct the dictation. If the dictation is not corrected, as indicated by the dictator, or both of the undesired text and the correction, they're both there, then you will be deducted. So oftentimes they'll restart a sentence and then kind of they start to say a sentence just like I just did there. They start to say the sentence and then they correct themselves and sort of restart it. So you need to write what they said the second time. Sometimes they do it in the middle of a sentence. So you will learn with practice what they wanted you to correct, so how far back to go or what to change. They may say, can you go back to the past medical history and add this? So you'll get used to that. It does take a little bit of practice. And especially when you get into the workforce and you're starting to hear the same dictators regularly, you just get to know their little idiosyncrasies, and it does get better with that as well. But just make sure if they're correcting themselves or if they're stumbling over something, you put what they said last. You want to correct as they dictated. Okay, copying and pasting. We talked about this quite a bit in part 1, so I'm not going to go over it in depth again, but copying and pasting is not permitted in any part of the program, including reports. So don't post your reports, your rough drafts, course material. Don't share it on Facebook. Don't copy it for your own good, or your own studying, any of that stuff, because it's all copyrighted material. Okay? All right. I don't know why all my pictures are showing a little lower than they were put when I designed this. But we have a little bit of time left. Just going to make it so I can see the chat boxes. Okay, so I do see a couple of questions here. So let me just get to the point where I can get a Word document open here, because I like to explain things with Word. Let's see here. Okay, can you guys see my Word document there? Someone can just let me know if you can see it. Perfect, thank you. Okay, so let's just see. I'm going to go back to questions. Okay. What about second digit? So second digit in terms of ordinals, you've got a first digit, which is your thumb. You've got a second digit, third digit, and so on. So that is part of a series. So we would write that as an ordinal. The patient was seen by doctor name in rehab. Okay, I'm just going to copy out this. Whoops, that did not copy. Control C. Here we go. Okay, so rehab medicine. So in this case, there's being in something. It's not a therapy being done to them physically, like the patient had occupational therapy. So we're talking about the actual therapy being done. How about I type properly? Everyone's watching and can't type. But in rehab medicine, we're actually talking about I can't speak apparently. We're talking about the department. So if we take out the name, seen, I'm going to take this out. Whoop. So seen in rehab medicine. We wouldn't say seen in Dr. Smith, so we don't cap it. So that's it. I would basically test that that way, or you could say seen by Dr. Smith in Dr. Smith. Again, doesn't work. They're not being shrunk like Honey, I Shrunk the Kids, put inside. So that would not be capped. They're talking about the department, but it's not being used as a proper noun. Okay. Now, we just have a few minutes. Is there a last minute question? Oh, Control F to look at specs. So let's just say on this page, I'm going to use this as an example, because this Control F function, so you want to hold the Control button, key down, and type in F. Okay? This works on almost everything. It works on web pages, emails, Word documents. So web pages, again, if you're in the course material, I'm trying to find a word on the page. Doesn't work in DictScribe, but it works on almost everything else. So if you hit Control F, so say on this page I want to find the word patient, and everywhere that it is. So I'm going to just click on the page so I'm in there, and then I'm going to hit Control F. There's a search button that comes up. Now, the search bar may show up in different places on your page depending on what program you're using, what browser you're using, etc. So I'm just going to type in patient, and it will highlight both times it's on the page. I could type in just a couple of letters like, I don't know, ER, and so anywhere that combination of letters is going to show up. It is so handy because sometimes too you're doing some research and you get onto a browser onto a web page, and it is just like text galore. And you're like, oh my gosh, it's going to take me forever to find what I'm looking for. You can just use your Control F, and it'll highlight what's on the page. And you can often have it so it highlights just one at a time, or you can have it highlight all of them. This is in a browser. I think there's also a setting for exact capitalization. I tend to not want to go with that in case it's the first word of a sentence or not. But yeah, it is so handy. Saved me a lot of time over the years. Okay, I think I've got time for maybe just one more question. Is there anything else? All right, guys. So again, I know he is here to be admitted to psychiatry. So let's just use our Dr. Smith trick again. Whoops. I'm really not, I'm not copying and pasting very well, am I? He is, oh gosh. I give up. He is here today to be admitted to psychiatry. Okay, so it's clear they're talking about a section of the hospital. So he is here to be admitted to Dr. Smith. Doesn't make sense. So we're not going to cap it. Okay. Yeah, Friday fingers on a Wednesday, basically. Okay, so I'm going to just go for one more question here. So can you go over the use of etc. versus etc.? So etc. the words and etc. the abbreviation. So this is just like a verbatim thing. ETC is an abbreviation of the words etc. So unless they clearly say ETC, or they tell you to write it as an abbreviation, you're going to write it at words. It would be very similar to if they said myocardial infarction and you wrote MI instead. So you're going to go verbatim and write the words. Okay? Also, just a quick tip before I go, and I know I said this in part 1, but I can't say it enough, just be sure you're reviewing your account specifics frequently. If you are new to the world of the account specifics, I would be reviewing them a lot. Just try to get to know them so you're not spending as much time looking stuff up. That goes too when you get into a new account in the workforce. Once you are feeling more comfortable with them, review them often still. So I tend to like to review a page each day before I start and just keep working my way through them. It puts me in work mode, sort of flips the switch in my brain, and reading one page just really quick. It's not overwhelming, keeps everything fresh in my mind. So that I don't forget any rules or kind of twist a rule up in my head so it's wrong now, sort of misremembering. So I would give that a shot. Reading 1 or 2 pages each day is a lot easier than reading the whole thing every now and then. So, sorry, the capital on etc. is just because it's the first word in a line. That's just what my words corrected it to. All right, everybody, thank you so much for coming. You're lovely as usual, and I hope that everybody has a fantastic day. Thanks very much.